I want to tell you a little bit about some of the things that are going on in the association that I think are really exciting and very timely. One of the things I do in the association is I'm the president of a specialty organization called the Society of PAs in Addiction Medicine, SPAM. We laugh about the acronym, but it's been an association around for a while. It was really founded and headed for a long time by a PA named Bernie Stutz, who did a great job with it. And addiction medicine has typically, within the PA realm, kind of been seen as a small thing on the side, and it's been sometimes difficult for us to get our topics on the main agenda of the association or with talks, because it's always been seen as being a small thing. But within the last year or two, as anybody who follows even just the popular news knows, that the opioid epidemic and the addiction has really exploded as far as both numbers and as far as attention from the media, and that's been something that's been really gratifying to us to see that. There's a law that was passed in 2000 that said that a new medication that was going to be used for addiction, sort of for opiate replacement, much like methadone has been used in the past, called suboxone. Suboxone is a combination, as people know, of buprenorphine and naloxone. And so suboxone was found to be helpful to help people replace the heroin or other opiates. And so a law was passed saying that physicians could prescribe this, but only physicians could prescribe this in outpatient settings. The PAs could not prescribe it, and NPs could not prescribe it. There is no particular rationale for that, other than there was a fear about this new medication, so there was thought that by restricting it, it would make it more palatable. Well, here we are 16 years later, and the same thing is true. There's still a restriction on PAs and NPs prescribing this. This has been a really area of strong focus from the AAPA staff, and they've done an incredible job on this, particularly a staff member named Sandy Harding, who has really made it one of her key items, and the AAPA has made it one of their key areas of focus, is to work on legislation at the federal level to allow PAs and NPs to prescribe suboxone. And recently, things have really been happening. In the last month, several bills passed the House of Representatives that would allow PAs and NPs to prescribe suboxone. And soon, I think it will go to the Senate, and there will be, all the sausage making involved as far as how that happens. But the hope is that sometime soon, months, it's hard to say exactly when, that something will pass allowing PAs and NPs to prescribe suboxone. This is a huge breakthrough. Something that's been a battle for 16 years. And we're very excited about that, and the AAPA has done an incredible job with that. Something else that's changed too in my world, I work in a methadone clinic where basically usually it's people with heroin addiction come and they take methadone to replace their heroin use, and best case scenario they stop using heroin and return to life as a normal human being. And for many years, there have been federal rules that said physician only, that PAs and NPs cannot write orders in these settings. In my setting, our state board of pharmacy has been very positive and helpful. So PAs and NPs have always been able to do this, but at a federal level, not the case. And one of the federal bodies recently has said, okay, we'll make a formal exemption process by which PAs and NPs can now write orders, admit patients, and to really broaden the access to care. So these two things have been incredibly exciting to see as far as big changes at the national level. Finally, another sort of symbolic thing is the American Society of Addiction Medicine, what's sort of the key physician body in addiction medicine. They have for years been physician only. They wouldn't allow PAs, they wouldn't allow NPs, not even as affiliate members or anything. So in the last year, they have created a membership category for PAs and nurse practitioners. It's a symbolic thing, but it's a very big symbolic thing, and it shows the inroads that PAs and NPs are making in large part due to the great efforts of the AAPA. So we're very excited about that.